According to the latest data from the CDC, 1 in 3 people over the age of 65 is experiencing memory problems or mild cognitive decline. You may have gone through moments like these. You walk into the kitchen but forget what you came to get. Or during a conversation, you pause, unable to recall the name of someone you know. At first, these moments may seem small, but when they happen repeatedly, you begin to worry. You wonder, is this just aging, or is something else happening to my memory? As our bodies grow older, our brains change too. Nerve cells become weaker, and signals travel more slowly. What many people do not realize is that some common medications, the tablets you may be taking every day, can quietly affect your memory. Many studies from Harvard and the NIH have shown that certain widely used drugs can reduce concentration, create a feeling of mental fog, and even increase the risk of memory decline when taken for long periods. This does not mean you should be afraid or stop your medication immediately. But it does mean you need to understand the risks so you can talk with your doctor, explore safer options, and protect your memory. In today's video, I will walk you through 9 common medications that can affect memory and alertness. I will explain why they impact the brain, the warning signs you should watch for, and the alternatives you can discuss with your doctor. Sit back, relax, and join me on this gentle but important journey. It will give you the knowledge and confidence to take better care of your brain every single day. 1. Opioids. Opioids are a group of strong painkillers. They are often prescribed when pain becomes severe, such as after surgery, in cancer pain, or in chronic conditions like osteoarthritis, back pain, or nerve pain. Common names you may see on a prescription include morphine, oxycodone, or hydrocodone. These medicines work by attaching to receptors in the brain and spinal cord. They help to block pain signals traveling to the brain. Their pain relief effect is very strong, especially when common medicines like paracetamol no longer work well. However, some studies suggest that long-term use of opioids may be linked to slower reflexes and reduced alertness. Many people describe the feeling as a mental fog, finding it harder to focus or slower to react in daily activities. According to a 2022 study by the National Institutes of Health in the United States, involving more than 3,000 people aged 65 and older, those who used opioids continuously for more than 6 months had about a 25% higher risk of cognitive decline compared with those who did not use them. However, researchers also emphasized that this result only shows an association and does not prove direct cause and effect. An analysis by Harvard Health also found that in older patients taking high doses of opioids for a long time, there were signs of weakness in areas of the brain linked to memory and reflexes. Long-term use of opioids can lead to several effects, especially in older adults. People often experience reduced concentration, finding it harder to focus when reading, watching television, or talking with their children or grandchildren. Slower reflexes can also raise the risk of falls, making simple activities such as climbing stairs or walking on slippery floors more dangerous. Some people also share that they feel less sharp in conversations, struggling to keep up with the pace of discussion. More seriously, prolonged use may lead to tolerance, meaning the body needs a higher dose to achieve the same pain relief. This increases health risks over time. If you are taking this group of medicines, the most important thing is not to stop them suddenly. Doing so can trigger unpleasant reactions such as shaking, insomnia, widespread pain, and even irregular heart rhythms or blood pressure changes. You should talk to your doctor if you notice frequent tiredness, confusion, or difficulty concentrating. Your doctor can assess your condition and consider adjusting the dose or finding a safer alternative. In some cases, your doctor may consider other pain relief options such as acetaminophen or low-dose NSAIDs depending on your health status. Include gentle physical activity. Walking, stretching, or light yoga can help improve circulation, ease some pain, and keep you more alert. Schedule regular checkups. Visit your doctor every 3 to 6 months if you need to take these medicines long-term, so your memory, reflexes, and overall health can be monitored. You should also take note. Avoid combining opioids with alcohol or sedatives. This combination can increase the risk of breathing problems or fainting. Be cautious if you have heart or lung conditions. Opioids can make these problems worse. Never increase the dose on your own when the pain returns. Always consult your doctor for safe guidance. Some early studies suggest that combining pain medication with supportive methods such as hot or cold compresses, physiotherapy, or rehabilitation exercises may help reduce the need for opioids. A diet rich in omega-3, found in salmon and sardines, is also thought to support joint and nerve health, although more evidence is needed to confirm these benefits. Opioids can provide great relief when strong pain control is needed, but long-term use carries potential risks for memory and alertness. It is important to stay aware of changes in your body, share any concerns with your doctor, and work together to find the safest, most suitable plan. This way, you can manage your pain while keeping your mind clear and steady each day. 2. Muscle relaxants. Muscle relaxants are one of the most common. Familiar names such as cyclobenzaprine or carisoprodol are often given when you have muscle pain, strain after heavy activity, injury, or chronic pain in the back, neck, shoulders, or other muscle groups. Muscle relaxants work by reducing nerve signals between the brain and the muscles. This helps the muscles loosen and reduces pain. However, this action on the nervous system can also make you feel drowsy, slow your reflexes, or make it harder to concentrate. In older adults, even small changes like this can increase the risk of losing balance and falling, especially when moving around the house or using the stairs. Some observational studies, such as a 2021 report from Harvard Health, have shown that people aged 65 and older taking cyclobenzaprine may have about a 30% higher risk of falling compared to those who do not take it. However, these results only show an association and do not prove a direct cause. This risk can rise if the medicine is taken with other drugs that cause drowsiness, such as sleeping pills or anti-anxiety medicines. The combined effect can make it harder for the body to stay in control. Using muscle relaxants for a long time can raise the risk of several issues, such as loss of balance, feeling dizzy or unsteady, especially when changing positions suddenly, reduced independence in daily activities, difficulty standing up, sitting down, or carrying heavy objects, and feeling easily fatigued during movement. Increased risk of falls and injuries. In older adults, a fall can lead to a hip fracture, wrist fracture, or even serious head injury. Reduced alertness, feeling sleepy, having trouble concentrating, or slower reactions during conversation. Dependence on the medicine. Long-term use may make your body get used to the drug, reducing its effect and leading to a need for higher doses for the same relief. If you are taking muscle relaxants, the most important thing is not to stop the medicine suddenly. Stopping too quickly can cause the muscles to tighten again or trigger other unpleasant reactions. You should talk to your doctor regularly. If you feel more tired, more drowsy, or notice a loss of balance, let your doctor know. Monitor your dosage. In many cases, your doctor may gradually lower the dose or adjust the type of medicine depending on your condition and overall health. Combine with supportive measures, hot or cold compresses, to help muscles relax and reduce pain. Physiotherapy, stretching or gentle massage can help muscles recover faster. Light stretching exercises. Basic yoga or deep breathing exercises can help your body relax and improve circulation. Stay safe at home. To reduce the risk of falls, keep your living space tidy, remove tripping hazards, install handrails on stairs, and ensure good lighting at night. In addition to medicine, some supportive strategies may help. Light exercise, walking, stationary cycling, or simple stretching exercises in the morning can improve blood circulation and support muscle recovery. A balanced diet. Include enough protein from fish, lean meat, eggs, or beans to nourish your muscles. Combine with vegetables and fruit to provide antioxidants. Stress management. Stress can make muscles tighten. Spend a few minutes each day to relax, practice deep breathing, or listen to soft music to help muscles release tension. Some early studies suggest that these methods may help improve flexibility and reduce mild pain. However, they do not replace prescribed medication, and more evidence is needed to confirm long-term benefits. Muscle relaxants can make the body more comfortable when pain or stiffness affects your daily life. But with long-term use, they may bring certain risks that you need to be aware of, especially the risk of falling or reduced alertness. It is important to pay attention to how your body responds, share any changes with your doctor, and work together to find the safest and most suitable plan. Remember, the information in this video is for your reference only. Do not stop or adjust your medication without guidance from your doctor. 3. Anti-epileptic medicines. Anti-epileptic medicines are an important group of drugs used in the treatment of many conditions. They are often prescribed to control seizures, reduce nerve pain, or, in some cases, to support the treatment of mood disorders such as bipolar disorder. Familiar names you may see on a prescription are valproate, also known as valproic acid, and carbamazepine. These medicines help stabilize brain activity, reduce seizures, and calm abnormal pain signals in the nervous system. However, some studies show that long-term use, especially in people over 60, may be linked to memory problems or slower responses in daily activities. Valproate and carbamazepine work by stabilizing the electrical signals in the brain. In people with epilepsy, nerve signals can fire in a chaotic way, leading to seizures. These medicines calm the nervous system, prevent excessive signaling, and help the brain function more steadily. But when the brain is calmed for a long time, some people may notice slower information processing or more difficulty concentrating. A 2021 meta-analysis from PubMed followed thousands of people over the age of 60 who used valproate long-term. The results showed that the risk of cognitive decline could be about 1.5 times higher compared with those who did not use the drug. However, the researchers noted that this was an observational link. It could not confirm a direct cause. This highlights the importance of regular monitoring of cognitive function. If you need to take the medicine, for a long period. When you take valproate or carbamazepine for an extended period, you may notice difficulty concentrating, slower thinking, fatigue, or drowsiness. If you are taking this group of medicines, it is very important that you do not stop or reduce the dose on your own. These medicines must be adjusted slowly under your doctor's supervision to avoid the risk of recurrent seizures or the return of nerve pain. You should monitor your cognition regularly. During follow-up visits, ask your doctor to check your memory and attention. Keep a record of any changes. If you or your family notice that you are more forgetful, have trouble focusing, or lose balance more often, write these down to share with your doctor. In some cases, your doctor may consider adjusting the dose or switching to another medicine, depending on your condition and how your body responds. Along with following your treatment plan, you can take supportive steps to help your brain function better. Add omega-3 from foods. Salmon, sardines, and other oily fish are rich sources of omega-3. Some early studies suggest that a diet high in omega-3 may support brain health, but more evidence is needed for clear conclusions. Stay active with light exercises. Walking, breathing exercises, or gentle yoga can improve circulation and help you stay alert. Train your brain. Reading, conversations, or other mental activities can help maintain flexibility in your thinking. Sleep well and sleep deeply. Quality rest helps the brain recover and supports better memory. Remember, these methods do not replace your prescribed medicine. They are only supportive. Regular checkups. Some studies show that this group of medicines may affect the liver or blood counts. For this reason, your doctor will often recommend regular tests to ensure safety during treatment. You should not worry too much. Many people take these medicines for years and manage their condition well, as long as they are monitored regularly by their doctor. What matters most is that you listen to your body, take note of even the smallest changes, and share openly with your doctor. This way, you can keep your treatment effective while protecting your memory and clarity in daily life. Fourth, first-generation antihistamines. Antihistamines are a very familiar group of medicines, especially when you need to treat allergies, colds, motion sickness, or simply to sleep more easily at night. Names such as diphenhydramine, often found in over-the-counter sleep aids or cold medicines, and promethazine have been present in family medicine cabinets for many years. These medicines can make you feel more comfortable by reducing sneezing, runny nose, or helping you fall asleep more quickly. However, some studies show that using first-generation antihistamines over a long period may be linked to changes in memory and concentration, especially in older adults. These medicines work by blocking histamine, a substance in the body that triggers allergic reactions such as sneezing, runny nose, or itching. At the same time, they also block part of acetylcholine, a neurotransmitter that plays an important role in memory, learning, and keeping the brain alert. When acetylcholine is reduced, the brain can slow down. In older adults, this may show up as trouble focusing or becoming more forgetful. A 2020 study from Harvard Medical School found that adults over 65 who regularly used first-generation antihistamines had around a 45% higher risk of memory decline compared to those who did not take them. Experts note that this result only shows an association and does not prove direct cause and effect. Even so, it is a signal that we need to be more careful when using this group of medicines as we get older. When you take first-generation antihistamines, you may notice some changes, especially if you take them at night or for several days in a row. Increased forgetfulness, a sense of mental fog, sleep that is not truly deep, difficulty concentrating. If you are using medicines from this group, you should talk to your doctor or pharmacist. Be clear if you often feel more tired, confused, or unusually sleepy. Check the ingredients on the label. Many products marked PM, such as Pain Relief PM or Sleep Aid PM, actually contain diphenhydramine, even if they are not labeled as sleep medicines. In many cases, your doctor may consider switching you to a newer generation of antihistamines, such as loratadine or cetirizine. These medicines cross the blood-brain barrier less, so they are less likely to cause drowsiness or affect memory. To improve your sleep, you can also try simple measures, such as keeping a regular sleep schedule or creating a quiet, cool sleeping environment to help your brain relax more easily. Alongside using medicines correctly, you can support your brain health with simple habits. Eat plenty of green vegetables, fruit, and fish rich in omega-3 to support brain function. Stay active with light exercise every day to improve circulation and maintain flexibility. Engage in mental activities such as reading or memory games to keep your brain active. First-generation antihistamines, such as diphenhydramine or promethazine, can help you sleep better or relieve allergy symptoms quickly. But if you use them for a long time, especially as you get older, they may affect your memory and alertness. Many people take these medicines short-term without serious problems. What matters most is that you understand their effects, pay attention to how your body responds, and talk regularly with your doctor to ensure safe use. 5. Antidepressant paroxetine. Among antidepressant medicines, paroxetine, often known by its brand name Paxil, is a very familiar name. This medicine belongs to the SSRI group, or selective serotonin reuptake inhibitors. It is often prescribed to treat depression, anxiety, panic disorder, or obsessive-compulsive disorder. For many people, paroxetine helps stabilize mood, reduces anxiety, and supports better sleep. However, some studies suggest that paroxetine may affect memory and alertness, especially when used long-term in people over 60. Paroxetine works by increasing serotonin levels in the brain. Serotonin is a neurotransmitter that helps regulate mood and feelings of well-being. But unlike many other SSRIs, such as sertraline or escitalopram, paroxetine has stronger anticholinergic properties. This means that, in addition to regulating serotonin, paroxetine also reduces the activity of acetylcholine. Acetylcholine is important for memory storage, information processing, and maintaining quick reflexes. When acetylcholine is affected, the brain may slow down, focus becomes more difficult, and short-term memory may decline. A study published in Frontiers in Psychiatry in 2021 followed thousands of people aged 65 and older who were taking antidepressants. The results showed that those using paroxetine had around a 30% higher risk of cognitive decline compared to those taking sertraline or escitalopram. This research does not prove direct cause and effect. However, it is a clear signal that monitoring memory and mental clarity is very important when taking paroxetine long-term. When using paroxetine over time, some people may notice short-term memory decline, forgetting small details such as names, the location of objects, or recent appointments, slower reflexes, taking longer to process information or respond in everyday situations, difficulty concentrating, a sense of mental fog, mild fatigue. If you are taking paroxetine, it is important that you do not stop or change the medicine on your own. Stopping suddenly can lead to dizziness, anxiety, insomnia, or a worsening of depression and anxiety symptoms. You should speak with your doctor if you notice memory decline or slower reactions. Attend regular checkups to allow your doctor to monitor how the medicine affects your memory and concentration. In some cases, your doctor may consider switching you to other SSRIs, such as sertraline or escitalopram. Only your doctor can decide which medicine is most suitable, as each person responds differently. Along with taking the medicine as prescribed, you can support your brain with healthy habits. Eat fish rich in omega-3, such as salmon or mackerel, along with plenty of vegetables and antioxidant-rich fruits. Walk, cycle gently, or practice yoga to improve circulation and boost your mood. Play logic games, read books, or learn new skills to keep your brain flexible. Ensure you sleep well and get enough deep rest to help your brain recover. Meet friends, engage in conversations, and join community activities to keep your mind active and your mood stable. Remember, these methods are supportive only and do not replace your medicine. Important notes: do not combine medicines without guidance. Paroxetine can interact with other drugs, including painkillers, blood thinners, or sleeping medicines. Monitor your body. If you notice unusual changes in memory, mood, or behavior, report them to your doctor immediately. Speak with your doctor regularly to make sure your treatment remains safe and appropriate. Paroxetine is an important medicine that has helped many people through difficult periods of depression and anxiety. What matters most is to monitor your body, attend regular checkups, and keep an open conversation with your doctor. This way, you can maintain a stable mood while protecting your memory in the long term. Sixth, antipsychotic medicines. Antipsychotic medicines are quite commonly used in the care of older adults. Familiar names such as quetiapine, also known as Seroquel, olanzapine, known as Zyprexa, and risperidone, known as Risperdal, often appear in prescriptions. They are used to manage behavioral disturbances, agitation, prolonged insomnia, or psychiatric symptoms such as delusions and hallucinations. In some cases, these medicines are truly necessary. They help the person stay calm and keep both the individual and their family safe. However, long-term use, or use without close monitoring, may be linked to unwanted effects on memory, concentration, and overall health, especially in people over the age of 60. Antipsychotic medicines work by reducing dopamine levels in the brain. Dopamine is an important neurotransmitter that helps regulate focus, motivation, quick responses, and the ability to feel interest and pleasure in daily life. When dopamine levels drop too low, the brain slows down. You may notice that your thinking becomes slower, your energy levels drop, or you feel less interested in your usual activities. A large study published in The Lancet in 2022 followed more than 25,000 older adults using antipsychotic medicines. The results showed that the risk of cognitive decline may increase within 12 months, according to this observational research, compared to those who were not taking these medicines. This study does not prove direct cause and effect, but it is an important reminder that these medicines should be closely monitored in older adults. When using antipsychotic medicines, especially for those over 60, you or your family may notice slower thinking, feeling that information is processed less quickly than before, reduced motivation, less interest in daily activities, even familiar hobbies. Some studies suggest that older adults with heart conditions taking antipsychotic medicines may face a higher risk of stroke. This makes regular monitoring of cardiovascular health essential. When memory and clarity decline, maintaining independence in daily activities can become more challenging. Antipsychotic medicines can be very helpful, but to use them safely, you should. Use only when truly necessary. Use the lowest dose for the shortest possible time. Dosage and treatment duration must always be decided by the doctor, as each person responds differently. Schedule regular checkups. These help evaluate memory, mobility, and detect side effects early. In many situations, non-drug approaches can help reduce symptoms and support treatment. 3 basic strategies include keeping the environment quiet and safe, reduce noise, avoid bright lights, and remove obstacles at home to lower the risk of falls. Maintaining a stable daily routine. A clear and consistent schedule can reduce anxiety and help the person feel more settled. Increasing positive social interaction. Meeting and talking with family or friends helps maintain connections and reduces feelings of isolation. These strategies do not replace medicine, but they can reduce dependence on it and help maintain mental clarity for longer. Monitoring and adjustment. Observe daily changes. If there are signs of excessive sleepiness, confusion, or difficulty walking, inform the doctor immediately. Monitor cardiovascular health. Check blood pressure, heart rate, and related indicators regularly, especially if there are existing heart conditions. When the condition is stable, the doctor will consider gradually reducing the dose and stopping the medicine safely. Antipsychotic medicines, such as quetiapine, olanzapine, or risperidone, play an important role in many situations, especially when behavior or emotions become difficult to control. But if long-term use is required, careful monitoring and close collaboration with your doctor are essential. 7. High-dose statins. Statins are a very common group of medicines, especially in people over the age of 60. Familiar names such as atorvastatin, known as Lipitor, or simvastatin, known as Zocor, are often prescribed by doctors to lower cholesterol. They help reduce the risk of atherosclerosis, heart attack, or stroke. Statins have saved millions of lives. However, some recent studies suggest that taking high doses of statins over a long period may be linked to mild changes in memory and mental clarity, especially in people over 70. Statins work by reducing the production of cholesterol in the liver. This helps reduce plaque buildup and protects cardiovascular health. Some theories suggest that when cholesterol levels drop too low, it may affect nerve connections in the brain. This is because cholesterol helps protect nerve cells and supports signal transmission. This may explain why some people taking high-dose statins for many years notice slower memory or less sharp reflexes. A study published in Frontiers in Aging Neuroscience in 2023 followed more than 3,000 people over the age of 70 who used statins continuously for more than 3 years. The results suggested that the group taking high doses of statins showed more signs of cognitive decline, about 26% in this observational research, compared to those not taking statins or those on lower doses. This study does not prove direct cause and effect, but it sends a clear signal that controlling dosage and having regular checkups are very important for safety. In some people, especially those using high-dose statins for many years, certain changes may appear. Short-term memory decline, forgetting familiar routes, needing more time to orient yourself when driving or walking, difficulty remembering names, a feeling of slower thinking. Statins bring great benefits in preventing cardiovascular disease. But to protect memory and brain function, you should discuss your dosage with your doctor. If you are taking a high dose of statins, talk to your doctor about your specific cholesterol targets and whether the dose needs adjusting. Schedule regular assessments. Include blood tests and cognitive evaluations in your health checkups. If you notice declining memory or slower reactions, write them down and share them with your doctor. Consider statins that have less impact on the brain. Medicines such as pravastatin or rosuvastatin cross the blood-brain barrier less and are often considered gentler on memory. Any change in medicine or dosage must be made only by your doctor, based on your heart health and your individual response. Along with taking the medicine as prescribed, you can actively protect your memory and brain with healthy habits. Eat plenty of vegetables, fruits, and oily fish, such as salmon or sardines, to provide omega-3, which may support nerve health. Walk for 30 minutes a day, cycle gently, or do yoga to improve circulation, which benefits both the heart and the brain. Sleep deeply and get enough rest. Manage stress. Practice meditation, deep breathing, or listen to calming music to relax your mind and reduce strain on your brain and heart. Remember, these methods are supportive only. They do not replace your statin medication. Statins are an important part of cardiovascular protection. For long-term safety, combine them with comprehensive care. Maintain a healthy diet, regular physical activity, and good control of weight, blood pressure, and blood sugar. When monitored closely and taken at the right dose, statins remain a reliable partner. They help protect your heart while supporting your memory and mental clarity in the years ahead. 8. Long-acting benzodiazepines. Benzodiazepines are a group of medicines that are commonly prescribed, especially for older adults who experience anxiety, stress, or persistent difficulty sleeping. Names such as diazepam, known as Valium, or lorazepam, known as Ativan, are familiar to many people. These medicines can help you relax, sleep more deeply, and reduce anxiety in the short term. However, some studies suggest that long-term use of benzodiazepines, particularly in high doses or over many months, may be linked to memory decline and reduced mental clarity, especially in those over 65. Benzodiazepines work by enhancing the effect of GABA, a neurotransmitter that calms the nervous system and helps the brain and body relax. When taken for a long time, particularly the long-acting types such as diazepam or lorazepam, the brain can gradually become less flexible. This may lead to slower reflexes and a sense of mental fog during daily activities. A study published in BMJ in 2022 followed more than 8,000 older adults over 6 years. The results suggested that those using benzodiazepines long-term had about a 51% higher risk of developing Alzheimer's disease in this observational research, compared to those who did not take them. Experts emphasize that this is observational data and does not prove direct cause and effect. Even so, it is an important signal for older adults and their doctors to carefully consider the risks of long-term use. When taking benzodiazepines for an extended period, especially the long-acting types, you may notice a sense of mental fog with difficulty focusing or processing information. Short-term memory problems, such as forgetting recent events or struggling to retain new information. Slower reactions, needing more time to make decisions or respond in daily situations. Reduced daily activity, with less energy and less initiative for familiar routines. Benzodiazepines may be necessary in some acute situations, but if long-term use is required, you need to work closely with your doctor. If you wish to stop taking the medicine, talk to your doctor about a safe tapering plan. Stopping suddenly can cause severe anxiety, insomnia, trembling, or even seizures. Have regular checkups to allow your doctor to monitor your memory, reflexes, and any signs of dependence. Remember, a gradual and well-planned reduction in dose is key to protecting your mental health and memory. With the right support from your doctor, you can manage sleep and anxiety while keeping your memory clear and your mind steady. 9. Polypharmacy. There is a medical concept that many people often overlook. It can have a direct impact on memory and mental clarity, especially in older adults. It is called polypharmacy, the situation where multiple medicines are taken at the same time. The concern is not only the number of medicines, but also the fact that many of them belong to a group with anticholinergic effects. When several of these medicines are used together, the brain carries a greater burden. This reduces acetylcholine, a chemical that is essential for maintaining memory, focus, and quick reflexes. Acetylcholine acts like an electric current in the nervous system. It helps brain cells communicate effectively with one another. When you take a medicine with anticholinergic properties, the level of this chemical in the brain may drop slightly. But when you take multiple medicines at the same time, such as sleeping aids, allergy medicines, nerve pain medicines, or bladder control medicines, the combined effect can lower acetylcholine more deeply. This can lead to noticeable changes in memory and alertness. A large study published in Age and Aging in 2022 followed more than 280,000 older adults over a period of 10 years. The results suggested that those with a high anticholinergic burden had about double the risk of developing dementia, compared with those with a lower burden. This research is observational and does not prove direct cause and effect. However, it is an important warning about the risks of using multiple medicines with the same mechanism over a long period of time. Some common groups of medicines that can add to this burden include first-generation antihistamines, such as diphenhydramine, often found in cold remedies or over-the-counter sleep aids, older antidepressants, such as amitriptyline, bladder control medicines, such as oxybutynin, anti-seizure medicines, such as carbamazepine. Sleep aids, many of which contain anticholinergic ingredients. It is important to know that some over-the-counter medicines also fall into this category. This can make it easy to underestimate the total amount of anticholinergic exposure. If you or your loved one are taking multiple medicines, the first step is to talk with your doctor or pharmacist. Review the full list of medicines. Write down all prescription medicines, over-the-counter products, vitamins, and supplements so that your doctor or pharmacist can evaluate them. Assess the anticholinergic burden. Your doctor can use specific tools to calculate your burden score based on your medication list. In many cases, your doctor may reduce the dose, switch medicines, or adjust the timing of use to reduce risk, while still maintaining treatment effectiveness. Schedule regular checkups to monitor memory, concentration, and other health indicators. Do not stop taking any medicine on your own. Adjustments must be carefully planned and supervised by a healthcare professional to avoid serious complications. Polypharmacy, or the use of multiple medicines, is not always harmful. In many cases, it is necessary to manage chronic conditions. But when several of those medicines affect acetylcholine, the brain may gradually lose sharpness and clarity over time. After the age of 60, memory and mental clarity do not depend only on diet or exercise. They also depend on how we understand and manage the medicines we take every day. Many reputable studies from Harvard, the NIH, and the WHO have shown that when you actively review your prescriptions with your doctor, the risk of memory decline can be reduced significantly. The most important thing is that you are not alone on this journey. Speak openly with your doctor at every follow-up appointment. Bring a full list of your medicines, including prescriptions, over-the-counter products, and supplements. Even a short discussion can help you find safe and simple adjustments that keep your brain healthier. Starting tomorrow morning, you can try small but effective changes. Add salmon to your breakfast, include a plate of green vegetables or avocado, and keep 15 to 20 minutes of light activity each day. These small habits will nourish your brain and help keep your memory sharp year after year. If you find this video helpful, share it with your family and friends. When everyone understands and cares for their brain health, we can help each other live healthier, clearer, and happier lives every day. Remember, taking care of your memory today is protecting yourself, so that every moment with your children and grandchildren, with your loved ones, stays full, warm, and full of energy. Thank you for watching, and I look forward to seeing you in the next videos.